Welcome back to Cyrex Education. I'm Robin Puglia. I am the VP of Education for Cyrex Labs in Europe, the UK and Ireland. And in this video, I'm going to be talking about how to perform a food challenge before food reactivity testing. And we're going to start with, should you challenge with a food? So sometimes it is important to obtain a formal diagnosis. And there are various different reasons that this might be important, including pressure from family members, or it's required for compliance by from schools, potentially even something along the lines of changing benefits or changing medical support or support from the medical system. So some people are happy to comply with, for example, a gluten-free diet just for themselves because they feel better and their own understanding of their body is enough. And for other people, they really require or would prefer to have communication with or diagnoses with their medical team, as it makes their relationship with their medical team healthier and more effective for them. For some people, seeing the results on a test may improve compliance. So usually when we're talking about should you challenge with a food, we're probably talking about gluten or potentially dairy, because those are the top two allergens, and it's very common for those to be taken out. People take themselves off those foods, or they're put on a gluten-free, dairy-free diet by a healthcare practitioner of some kind. And then a little bit further down the road, we come to the question of, can I reintroduce this food? Do I need to be off this food permanently? Is this food related to a medical diagnosis that I have? And that's when we come to, should we challenge in order to run food reactivity testing to understand the immune relationship with this food. So if somebody is struggling with the gluten-free diet or with the dairy-free diet, then potentially seeing that they have antibodies to that food on a test result may really help them with improving compliance, especially if their symptoms are not that black and white. If somebody has very significant symptoms of pain, for example, or fatigue when they eat a food, then often it's easier for them to comply because they don't want to feel like they feel with those symptoms. However, sometimes elimination of the food alone won't reduce the symptoms enough to adequately determine that food's role in inflammation. So if somebody is taking immunosuppressant meds, if they have an active infection, if they have broken oral tolerance issues, then reducing the food might reduce the immune burden or the inflammatory burden for that person, but it's not the magic bullet. It doesn't completely resolve their symptoms, or it only reduces inflammation, or only reduces symptoms, let's call it 20 to 25%. And because they have so much inflammation coming from other areas, it isn't that clear to them whether or not the food is contributing directly to their symptoms, yes or no. In complex cases in autoimmunity, there can be more than one trigger, or even if it's the main trigger, the inflammatory cascade might be so advanced that removing the primary trigger won't be enough to resolve the inflammation, enough to affect symptoms enough that there's a very strong cause and effect between the trigger and the symptoms. So this is sometimes, I see this in my clinical practice a lot when there is a problem with broken oral tolerance. If somebody is reacting to 120 out of 180 foods, just eliminating one or two of those foods, even if those foods are profoundly pro-inflammatory, such as gluten or dairy, won't be enough to reduce the inflammatory burden enough that there will be a clear understanding about the impact of those foods. You would have to reduce the inflammation down enough that when you reintroduce the food, enough inflammation is created from that reintroduction that there would be more of a black and white picture there. So the analogy that we use a lot in functional medicine is, if you are sitting on two nails and you take out only one of the nails, you haven't necessarily reduced the pain by 50%. You still have you still have a significant amount of pain because you're still sitting on a nail. So the same is true if you have broken oral tolerance, or if you have a substantial inflammatory burden. If you're reacting to gluten, dairy, soy, corn, eggs, and beef, and you only reduce gluten, or you only eliminate gluten or gluten and dairy, you have enough other inflammation there that the relationship to gluten won't be as cut and dry, for example. So testing will help you understand what the landscape looks like. So another issue with autoimmunity is that, or another issue with food reactivity in general, in fact, is whether or not the food needs to be eliminated permanently. Now, with celiac disease, of course, gluten needs to be eliminated permanently. If you've got another gluten-reactive autoimmunity, it needs to be eliminated permanently. And the same is true, for example, if you have a food that is cross-reacting with another tissue. So if you have a food that is cross-reacting with thyroid tissue, for example, that food will need to be eliminated permanently. But for other people, gluten won't be a primary trigger for their autoimmunity, but it will be pro-inflammatory. Gluten is always inflammatory, and it always creates a degree of intestinal permeability, irrespective of somebody's autoimmune status. So understanding whether or not a food needs to be taken out permanently, or whether or not it's contributing to, because it is a direct trigger of autoimmunity, meaning that when they eat that food, the immune response to that food is directly creating autoimmune attack to the tissue, versus when you eat a food, it creates inflammation, and that inflammation is general and non-specific, and that can be co-activating autoimmunity. But does that food need to be taken out permanently? If you can get that person into remission, if you can reduce inflammation in all other areas, if you can achieve a healthier immune homeostasis, perhaps that food could be eaten on rotation. Perhaps we could be including small amounts of organic home-prepared food as part of a diverse, varied diet. And you would need testing to determine whether or not that is true. So understanding if it's an immune trigger or just a general inflammatory trigger, you require testing for that information. So again, some people are happy to just cut a food out permanently. There is no nutritional reason that gluten needs to be in the diet. However, there are lots of reasons that we include foods, and if you don't need to eliminate a food permanently because you have no immune tolerance to that food, then there is a conversation that needs to be had about the ability to include certain foods in certain situations as part of a healthy, balanced, broad, varied, and diverse eating plan. So this is how you challenge. So we recommend that you eat the food 3 times a day for 1 week. So we call this week 1. You're then going to draw blood 25 to 50 days later. So we recommend that you draw the blood on week 5, potentially week 6. If the person has symptoms in the first couple of days or within that first week, and those symptoms are associated with their autoimmune condition or with their primary complaint, or they become significant and unsustainable, then you wouldn't continue with challenging or wouldn't continue with testing. At the end of the day, gold standard is, if you eat this food, do you feel worse? And if you eliminate the food, does it improve your symptoms? And when you reintroduce the food, do your symptoms recur? That is gold standard for whether or not you should be eliminating that food, yes or no. So if you reintroduce a food and somebody's symptoms are reactivated or persist, then it's not necessarily recommended to continue with eating the food 3 times a day for the entire week. For other people, there are various different recommendations around how much of the food you need to eat. So 3 times a day is a food challenge. However, for many other people, half a piece of bread or a couple of teaspoons of flour mixed into a yogurt or a soup or something like that will be adequate. So when not to challenge, this is very important to understand. So we would never recommend that you would challenge gluten in somebody with any gluten-reactive autoimmune condition. So with somebody with celiac disease, do not challenge that person. If somebody has gluten-reactive neurological autoimmunity, gluten ataxia, dermatitis herpetiformis, don't challenge with gluten for that person. If you're dealing with a child who has had significant gluten reactivity, but that has led to significant immune-mediated symptoms or significant neurological symptoms or presentations, I would not recommend challenging with gluten for that child or for that person later on in their life either. If somebody has a significant neurological condition or significant neurological symptom presentation, I would be very hesitant around challenging with a food that you've eliminated because it helps with symptoms. If somebody has unstable health or unstable illness or symptom presentation, I would be disinclined to be challenging with foods in order to get a test result. I would wait until they have reached remission or a more stable place in their illness. So any child whose immune symptoms or brain health has improved or stabilized on the gluten-free diet, please don't challenge with gluten in that child. Or anybody on significant immunosuppressants. When the antibodies have been suppressed down below range or suppressed down into manageable range, it is potentially unwise to be challenging with the food, because you won't be able to get an accurate test result in order to understand what the immune relationship with the food is. So the immunosuppressants may suppress the ability of the body to respond appropriately despite their food being an issue. Symptoms may be suppressed by the immunosuppressant medications, but also test results might be skewed by the immunosuppressant medications. So they are potentially not a good candidate for challenging with the food. So which food do you need to challenge for which test? So Cyrex Array 3X is a gluten and wheat panel. So the person would need to be eating gluten and wheat in order for this panel to be an appropriate choice. So if they're on a gluten-free diet and they are an appropriate candidate, then you would challenge with gluten in order to run Array 3. For Array 4, so Array 4 is dairy, gluten-free foods and gluten cross-reactive foods, and also some of the common allergens. So it includes soy, corn, rice, eggs, buckwheat, amaranth, teff, and a few other foods besides, but it primarily looks at multiple peptides and proteins from dairy products. So you would be challenging with any of the foods on Array 4, any of the foods found on Array 4. You do not need to be eating gluten to run Array 4. So even though the name of the test is gluten-associated cross-reactive foods and food reactivity panel, you do not need to challenge with gluten to run Array 4. The person does not need to be eating gluten to run Array 4, and you can run Array 4 on anybody, regardless of their relationship with gluten. So Array 10 is our most comprehensive food reactivity panel. There are 180 foods tested on Array 10. So some common questions that I get are, does the person need to be eating all 180 foods? And do they have to be eating all 180 foods within that 1 week time frame that we challenge in order to run the test in week 5? So the question that is being answered by this test is the diet that this person eats a contributing factor in their illness? So if somebody has never in their life eaten okra is not going to be a contributing factor in their illness. If somebody is a vegan or a vegetarian, then then cow's milk, or if they're a vegan, or beef if they're vegetarian, is not going to be a contributing factor in their current illness. So they don't have to eat any foods, they don't have to challenge with any foods, or eat any foods, or incorporate any foods that are not part of their everyday diet or their year in, year out diet, right? If they haven't eaten that food naturally in the last 12 months, then you don't have to challenge with that food in order to get an accurate representation of what of their health situation from Cyrex Array 10. However, if they have eliminated a food because it's part of the autoimmune paleo diet, but it never caused them symptoms, or because there was a question mark around it. So if they've eliminated a food that is on this test, let's call it salmon, but they're not really sure if the elimination of salmon has been helpful or not, if they haven't been able to ascertain whether or not that was actually a helpful intervention, then you may want to reintroduce salmon, even if they haven't eaten it in the last 1 year or 2 years. If they're not sure about their relationship with the food, but it is a food that they would like to eat and would like to include as part of a healthy balanced diet for that person, then you would consider challenging with the food. The other question that I get a lot about Array 10 is if somebody is on a very restricted diet, if they are eating a standard British diet, standard Western diet, if they're on autoimmune paleo, would you run Array 10 And the answer that I personally give is this. What we're aiming for is the least restriction as possible. If somebody's only eating 7 foods, then it is probably not a reasonable clinical strategy to eliminate 4 more of those foods because they've been antibody positive on a food reactivity test. So if somebody is eating only a standard British diet, a standard Western diet, which is highly processed, then my clinical intervention would be actually to change their diet first, to switch them over onto a more health promoting diet. And when they've been on that for a reasonable amount of time, which might be 3 or 6 months, then to run and have a look at their immune relationship with food and assess their oral tolerance to food, right? First, you need to work on nourishing the body and to improve and broaden out the diet and to create common sense nutrition interventions first. So if somebody's on a very limited diet, or if somebody is on a very unhealthy diet and you want to tidy up that diet first, then that might be more appropriate before running Array 10. So we're using our common sense. We're trying to understand if the person's diet as they eat is a contributing factor to their illness. We don't necessarily need them to be eating all 180 foods, and they certainly don't have to eat all 180 foods in that 1 week food challenge window. So it is slightly different for Array 10. I hope that has been helpful, and I look forward to speaking with you all in my Cyrex support calls for Regeneris to help you interpret the test results for Cyrex Array 3, Array 4 and Array 10. Thank you very much.